Heart attack is the leading cause of death in the United States, with approximately 1.2 million new and recurrent coronary attacks per year. About 34% of people who experience a coronary attack in a given year die from it. While recent medical advances have reduced the damage and deadliness of heart attacks, success depends upon speedy implementation of the most advanced remedies. Here to talk with us about the signs and symptoms of a heart attack and the importance of rapid diagnosis and treatment is Margie Hobbs with West Florida Hospital. Margie, thanks for being here.
It's my pleasure, Jeff.
Well, as a nurse, how do you define chest pains?
Well, everyone is familiar with the classic symptoms of chest pains, the left-sided, going down your arm, you know, this just terrible feeling in your chest. But what many people don't understand or realize is that there are many different symptoms that can indicate that you're having a problem with your heart. Those symptoms can include, of course, the classic ones, but also symptoms such as nausea and vomiting, shortness of breath, breaking out in a cold sweat, extreme fatigue, pain in your jaw. Sometimes people go to the dentist. They also pain through to your back. And women and people who have other kinds of medical problems such as diabetes often have very different symptoms of heart problems. So we need for everyone to understand that it's not just the classic left-sided chest pain going down your arm. There are many different things.
Great information to bring out. Well, we all like to self-diagnose. What are some common things that people try to explain away?
Well, the classic one is, oh, it's just indigestion. You know, they tend to think that they can just take an antacid and it'll go away. And sometimes it may actually feel a little bit better after you take an antacid, but that does not mean that it's not your heart that's the root of the problem. Another common thing is that people will say, oh, well, this must be because I did all that yard work yesterday. So they'll tend to think it's a pulled muscle. Again, you know, it does, anytime you're having symptoms, from here to here, you need to get it evaluated.
Well, why do you think people tend to kind of ignore it away? And you think it's from lack of education, or they just don't want to think about it, or they don't like to go to hospitals or doctors? Why do people say, well, I'll see how I feel tomorrow?
Oh, it's all of those things. Of course, nobody wants to think they have anything wrong with them, so we're always in this denial mode. And then we worry that we'll upset the people around us. Our family might be concerned and get all worked up if we are having some kind of problem. Sometimes people do avoid medical care because it sounds kind of silly when you think about it, but they're afraid that there's nothing wrong, then that they'll feel silly if they go to the emergency department and they evaluate them and they say, well, it's not your heart. Well, that's a great thing. We'd love to be able to tell somebody, well, it's not your heart. That is much better than saying, well, you know, we found that you have a serious problem going on. Sometimes people worry about the expense. And of course, nothing's free today, but one thing I want people to remember is that preventative care is much, much less expensive than after the fact care. And we know that if you can begin treatment sooner, you'll have less damage to the heart. So you'll be able to have a better lifestyle, and there's much less complications afterwards if you can begin the treatment sooner rather than later.
So people should be proactive. They should not risk being embarrassed or be worried about that. They should just come on in and get that early treatment.
That's right. That's correct.
Well, what kind of treatment would the early treatment entail possibly?
Well, when you begin having symptoms that could be your heart, we want people to know that they need to immediately call 911 and take the ambulance to the emergency department. And then when they get to the emergency department, we can very quickly do an EKG, which tells us almost immediately if you're having a very high-risk heart attack. And if you are, then we have all the processes in place to very, very quickly take you to our cath lab so that you can get the treatment that you need in the cath lab. If you don't need to go immediately to the cath lab, and not everyone does, thankfully, but if you don't, then we have a way of evaluating you that involves lab work and other kinds of X-ray type workup, so that we can decide if you are having a heart attack and then how we can better manage you. Another kind of population that you want to think about is, of course, there's the ones that are in the middle of having a heart attack right now, or you're having a very, very serious cardiac event. And sometimes we just can't figure it out that quickly in the ER in a couple of hours. So we need to come up with a very safe way of evaluating people very quickly.
Sure.
So that we can very safely return them to home. We don't want to just pat you on the shoulder and say, oh, no, everything's fine, and you walk out the door when everything is not fine.
Right. Well, one, I wanted to congratulate West Florida Hospital on earning the accreditation as Accredited Chest Pain Center. Tell us a little bit about that accreditation and what that means.
We're very proud of that. We received that accreditation in February of this year from the Society for Chest Pain Centers. Now, that is a group that is very closely aligned with American Heart Association and American College of Cardiology. And they are a nonprofit international organization that is solely dedicated to improving patients who are experiencing problems with their care.
So what does this mean in terms of treatment strategies, possibly?
Well, what it meant for us is that the society has a very, very strict set of criteria which you must meet, and these criteria are based on the latest state-of-art treatment and medical management that's available. And so we have to demonstrate to the society that we have met all that criteria and that we are continuously evaluating our processes to make everything even better and better.
So what does that mean for the patients in the community? I guess that's the end result.
That's the end result. Well, what it means is that we are able to provide for the patients the right treatment at the right time so that we can minimize or decrease the damage to the heart. Also, a big focus of the society is community education because, as we just talked about, it's very important for people to get timely evaluation.
Well, we appreciate you coming on the show and doing that today. Before we wrap up, if our viewers want more information, where can they go?
Well, they can go to our website. There is information about our chest pain center on the website. We also have various little flyers that we have posted around town, and they can always call the hospital.
Okay. Well, congratulations again on that certification, and thanks for being here.
You're welcome.